Gallbladder is a small organ in your upper right abdomen, right below your liver. It is a pouch that stores bile, a green-yellow liquid that helps in digestion. Issues with your gallbladder typically occur when something is blocking its bile duct like a gallstone. Now, people who have gallstones are often told to get it operated. Let's know it from the expert about gallstone surgery and precautions.
See, I said the causes for gallbladder stones, the most of the people think that it is dietary. Okay. So the misconception is because of increased fat in the diet, gallbladder stones are caused. So that's not true actually. See, gallbladder stones has gotten hereditary reasons and other reasons. The hereditary reasons usually will occur in childhood. Like we have seen some young patients, like within 10-year-old, between 4 to 10-year-old patients having gallbladder stones. So whenever these children have gallbladder stones, then definitely there is an hereditary predisposition because of some congenital disorders. There are some blood disorders like thalassemia or sickle cell anemia or hereditary spherocytosis. In these cases, what happens is there will be stones called as a pigment gallstones. Okay, but in other patients, usually which is more common in females who are obese, usually more than 40 years of age, these are not the causes for gallbladder stones. The three causes which I have mentioned, the blood disorders. So usually what happens is the bile will have both bile salts, bile pigments, and then also there will be cholesterol in that. So whenever the cholesterol content in the bile, not in the blood, in the bile increases, the bile becomes thick and this causes gallbladder stones. Yeah. See, the most common symptom of a gallbladder stone is pain abdomen. So the pain normally will be located in the right side upper abdomen where the gallbladder is located. And normally the pain will radiate to the back near our scapular bone. Okay. So the most common symptom is pain, and pain usually occurs after intake of fatty food. Like for example, let it be paneer or milk or any non-vegetarian food items. So whenever they eat this fatty food or oily items, the pain occurs. Okay, so the most common symptom is pain. So there will be other symptoms also, like dyspeptic symptoms, like they may have symptoms like gastric symptoms. Okay, what the patient usually, now one of the few patients complain like they have symptoms pertaining like gastric symptoms like abdominal bloat, postprandial dyspeptic symptoms, abdominal bloating or excessive flatulence. These can also be symptoms of gallbladder stones. And in some extreme cases, the patient will have severe pain abdomen which will be radiating to the back. Few patients may start having this in the later stage because of the stones getting slipped from the gallbladder, from the bile duct. So these are the symptoms. Some patients may have pancreatitis, that is the gallstones will slip from the gallbladder and then block the pancreatic duct. So these are all severe cases where the stones get slipped from the gallbladder and block the bile duct or block the pancreatic duct. Unlike kidney stones or renal stones, the gallbladder stones doesn't have conservative line of management like by medicines or something like that, because the composition of kidney stone is different and the composition of gallbladder stone is different. Okay, so the gallbladder stones contain more of cholesterol, unlike kidney stones which contains more of calcium. So gallbladder stones doesn't have a medical line of management, but medical management has been tried in some patients who have single stone and the size of the stone is less than 4 millimeter. In those patients, medical line of management can be tried, but it is not very well proved that medical line of management will help to dissolve gallbladder stones. So the most common option and available for gallbladder stones is surgery. That is removal of the gallbladder along with the stones. So why we remove the gallbladder? Because the cause for gallbladder stones is gallbladder itself. So we need to remove the gallbladder along with the stones which are there in the gallbladder. This is most commonly done by laparoscopic approach, or what we call as a keyhole surgery, where we make small cuts in the abdomen, just 1 centimeter in half centimeter cuts, and through that cuts we'll be removing the gallbladder along with the stone. So the treatment for gallbladder stones, which is standard and has been followed for more than 100 years, is removal of the gallbladder along with the stones. The surgery is very safe. It doesn't cause any much side effects, because many people have this misconception that after removal of the gallbladder they will be having some gastric issues and all. No, because the bile is produced in the liver. Okay, and the bile is something which helps in digestion. So once we remove the gallbladder, the bile from the liver directly goes to the intestine through the bile duct. So it doesn't have any side effects, because once the stones are formed in the gallbladder, that means that the gallbladder is not functioning. So removal of the organ which is not functioning doesn't cause any side effects. The patient can eat normally, he can move around normally, he can do all the activities normally after surgery. See, the patient will stay only 1 day in the hospital. Like, he will come on the morning of surgery, get the surgery done, go back home the next day morning after breakfast. So 1 week following surgery, we tell the patient not to take too much of spicy and too much of hard food. So after 1 week, he can take as normal food like he was taking before. Physical activity, he can be up and about within 6 hours after surgery. Since the surgery is done by laparoscopic approach, he will be mobile 6 hours after surgery. And lifting heavy weights has to be avoided 2 weeks following surgery. He can have his normal diet 1 week following surgery, and routine activities within 1 week or 2 weeks following surgery. So there is no extra precautions to be taken following a gallbladder surgery, since this surgery is done by laparoscopic approach. There will be early return to work, there will be early return to activity, there will be less infection, less chance of bleeding, and less, as you know, that is more cosmetic also. Yeah, we tell them to have a soft food like rice, idli, pongal, upma, all those are fine. We tell them to avoid too much of spice and too much of oil for 1 week. You can have regular fruits, vegetables, dal, paneer, all those are fine.